Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another educative piece of Health Matters. Our topic of today will be hypertension, and I am joined by a health expert who is going to explain more to us about hypertension. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you for having me once again on your show.
Yeah, and we're glad you could join us again.
Thank you very much. My name is Dr. Muhammad Ali Omar. I am a medical doctor based in Nairobi currently, and practicing clinically, seeing patients on a day-to-day basis. And I feel it's one of the good, important, I would say, topics to discuss because a good number of the patients, at least I see in my practice, tend to have hypertension. So what is hypertension? Maybe for those of us who do not know, hypertension, in other words, is what people call high blood pressure. People also know it as ugonjwa wa pressure, or some people call it as mikono pressure. So it's known by a various number of names and terms, but the medical term that we use is hypertension.
Okay, and what causes hypertension, just to begin with?
Okay, so there are a varied number of reasons or let me say causes of hypertension. In about 90 to 95% of the time, we do not know the exact specific cause of the hypertension. In about 5 to 10% of the time is what we call secondary hypertension. So there are two kinds of hypertension. There's what we call primary hypertension, which is about 90 to 95%. Then there's secondary hypertension, whereby there's an underlying cause. Now, in the underlying cause, you normally have to investigate before you start the patient on treatment. It could be things to do with, for example, thyroid disease. It could be things to do with what we call adrenal disease. And there are a number of causes, or there are a number of treatments for this. The other, I would say 90 to 95% of the time in which we do not know specifically, we have an idea but we do not know the specific exact cause, is to do with genetic predisposition, which means that someone in your family, either maybe your mom's side or your dad's side, which is, your relative, has hypertension, so you're at a risk of developing high blood pressure later on. Other things are to do with environmental and diet, and I think we'll also discuss this as we're going along the discussion.
Okay, and what are the early signs of hypertension?
So in hypertension, again, is good for you, number one, to know your family history. A good number of us do not know what our parents, our grandparents, or our uncles, aunties are suffering from. I'm not saying that you specifically have to know each of them, but if you have a family risk of high blood pressure, then you understand that you also are at high blood pressure. You're at a risk of developing high blood pressure. I would say most times high blood pressure is what we call a silent disease. When I say silent, it means that the symptoms do not present specifically in any way, as someone would be very fine. They're not having any headache, they're not having any chest pain, any abdominal pain, and they're walking and moving about their daily lives. And all of a sudden, one day, you would see someone developing probably blurriness in vision, they cannot see, or they develop a very severe headache, they start vomiting several number of times. And you come, and one of the first things what we do is what we call the vital signs when we come to the health facility, and you'll see that this person's blood pressure is above 180, above 200, and that's a patient you have to start treating as soon as possible, is what we call a hypertensive emergency. So a good number of times, maybe just to come back to your question, is hypertensives will not be sick. It's not like, I have malaria whereby I have a headache, or I have joint pains, or I'm having a fever. You would be asymptomatic without symptoms, and then you go to the health facility and your blood pressure is done. So it's good for you to always keep on checking your blood pressure. Then, as I said, most patients, but then you have a smaller percentage of the patients who would develop very severe headaches that do not resolve, for example, on taking over-the-counter painkillers like your Panadol, etc. If you develop like sudden visual blurriness, it lasts for a few seconds, 2 to 3 seconds, and then you come back, or like you're driving and then you cannot see the road very clearly. So it's at least one of those signs, you have to investigate. It's not something where, you say it's going to become normal. Or you'll have someone developing a sudden chest pain, something that, have sudden chest pain, lasts a few seconds and goes away. Or they develop some weakness in one side of the body, and then, it resolves away. So all those are things which, we should not take lightly. If any of those happens, then it's good at least for you to be reviewed by your doctor. And, at least we are able to see whether there is high blood pressure or not.
Okay. And are there diseases that cause hypertension? Like, let's say if someone is diabetic, can that diabetes cause hypertension or something?
Okay, so the answer to that question is twofold. One is there are certain diseases which you have. If you have, then they predispose you to develop high blood pressure. Then the second thing is there are certain diseases which you have. If you have that, you would also be at a risk of developing high blood pressure. So number one is, for example, if you have a thyroid disease or hyperthyroidism, whereby your thyroid hormones are increased, then you would, for example, be at a risk of developing high blood pressure. Second thing is adrenals. There's an organ called the adrenals in the body, and sometimes you can have tumors of the adrenal organ or cancer of the adrenal organ. And in someone who has that, for example, they overproduce adrenaline, for example, and what happens is they would tend to develop high blood pressure. So that is a disease which you have. If you have, then you would develop high blood pressure. That's number one. Number two is diseases which occur concurrently. I would say a good number of times, whereby if you have one disease, then you are also at a great risk of developing another disease. So these are what we call lifestyle diseases. For example, if you're a diabetic, then you are also at a slightly greater risk of developing high blood pressure. If you have what we call hyperlipidemia or increased cholesterol levels, for example, then there is an increased chance of you developing high blood pressure. So those are the way that you look at it. If you have these lifestyle diseases, it's always good for you to at least monitor your blood pressure. By monitoring, I mean maybe once every, if you don't have high blood pressure, then once every maybe 2 weeks, if you're just walking, close to a pharmacy or to a hospital, just take your blood pressure readings and just know where you lie along the spectrum.
Yeah. And is there an age that gets more affected with high blood pressure?
Previously, a lot of the studies showed that high blood pressure would be slightly in the older population. I would say maybe 45, 50, going above that. But currently, because as I've said, we are also evolving in terms of lifestyle. We are much more sedentary. We do not exercise as much. We have a lot of, junk food that we're eating. And you would see, even I have some of my patients in my facility who are as young as, I would say, 28, 30, and who develop high blood pressure. And a lot of them is to do with the lifestyle that they live. Then the other people, it is to do with, family risk. So previously, I would say it was more in the older population, but currently what we are seeing is even in the younger population, we have people who are developing high blood pressure.
And also, does it have stages? If someone who's young has high blood pressure, does it start with let's say the onset stage? Is it the onset stage or the full-blown stage, let's say?
So in terms of stages, yes, we have what we call classification of stages of hypertension. There's what we call the pre-hypertensive phase, and then there's a stage 1, the stage 2, stage 3. A lot of these are dependent in terms of clinical guidelines that we use. Let's say maybe every 1 or 2 years, we have the experts in hypertension, for example, or high blood pressure, coming and sitting down. Every country has what we call, their own consensus teams that come together, and they review the guidelines in terms of treatment, management, how to classify if someone has high blood pressure, etc. So, for example, currently what we're using is the certain readings we use. If you look at the blood pressure readings, a good number of them, you have an upper value and you have a lower value. So that's what we call the systolic value and the diastolic value. So you want the upper value to be less than 140, and then you want the lower value to be less than 90. So above 140 and above 90, then you're classified as hypertensive, okay? That's number one. And number two is that now, how high above 140 and how high above 90? For example, if stage 1 is you would be between 140 and let's say 160, then 160 to 180 etc. Again, it's not specific for you to know a must in terms of that I'm stage 1, stage 2, stage 3. It's important for you to know, am I hypertensive or not? Then classification according to the stages, now that is for the medical practitioners to know what stage is this, how can I manage it, how can I bring it down. But the key thing for you is to know, do I have high blood pressure or not? Am I at a risk for developing high blood pressure or not?
Okay, and what can someone do if they have hypertension? They are having a sudden attack. What's the first thing to do?
Okay, so again, sudden attacks, they are varied. It could range from, having a stroke, whereby you have a sudden stroke. Someone went to bed at night, they were okay, they ate their dinner very well. Then in the morning, they wake up and one half of their body, they cannot move it. That's, an emergency, okay? Sometimes you have someone who's okay, suddenly develop, a chest pain, which is very severe, and those are all emergencies, so the attacks can vary. So in terms of the viewers watching, the key thing for you to understand is that if you have sudden chest pain, especially more on the left side, because that's where your heart is, or sometimes along, the left upper arm, or you have sometimes along the neck over here, that's an emergency and you need to be reviewed as soon as possible. If you develop sudden weakness on one side of your body, then that's also an emergency. Or you suddenly were able to speak very well, seen more commonly in the slightly older population. You're able to speak well, and then your words become jumbled up, or you cannot find words, then that's also an emergency and you need to at least get reviewed. If you develop, for example, visual blurriness on one side or one eye, and you cannot see well all of a sudden, and just becomes black or dark or something like that, and then all those are emergency signs which you need to at least get reviewed by a medical practitioner.
And is high blood pressure curable or treatable?
Okay, so the key thing that we're driving towards right now is to at least maintain the blood pressures below the levels which I had mentioned earlier. It's one thing is you must understand is this is a chronic illness that we have, and the key thing is that in a lot of these chronic illnesses, I would say they're lifelong in terms of you staying on treatment or management for them. So as someone who has high blood pressure, for example, the key thing for you to understand now is that, can I be able to control my blood pressure below the recommended levels or below the levels which put me at risk for certain emergencies like a stroke, a heart attack, kidney failure, etc. And I have a good number of patients of mine who are hypertensive for the last 10-15 years, but they're controlling their blood pressure very well on medication, and they live their life as normal as possible. So it's important for me to pass the point that if you are diagnosed to be having high blood pressure, then it is not a death sentence, okay? People have lived with it for a long time, and in fact they die because of other reasons other than high blood pressure. So the key thing is to be able to monitor it and maintain it below the levels that are required.
Okay, and Are there environmental factors that can lead to hypertension?
Yes. So environmental factors, most commonly it's to do with the diet. That's number one, very key. Number two is a lot of, in terms of the environment, is it work-related environment, your home environment, are they stressful kind of environments, okay? Whereby if, for example, you have a very stressful work environment, what happens is that you're always anxious, you always have to, you're not meeting your deadlines, etc. What happens is that, also your blood pressure can rise. If you go home and, if at home always there's, bickering that's happening between the husband and wife, children not doing as well as they should, wife is always fighting the husband is always fighting the wife, then, that is always an issue in terms of also raising your blood pressure, because you're always angry, you're not your normal self, etc. Okay, and a good number of those, once they come and we sit down with them, we try to find out what the problem is, and then you get to the root cause of the problem. A good number of times, then you're able to bring mahabba in the house. Then three is to do with diet. Studies have shown that especially salt, which is chumvi, kwa Kiswahili, salt is a risk factor for developing high blood pressure, whereby, for example, communities that have a high salt intake. The best example is I have been to the coastal areas, whereby a good number of the people there, for example, eat fish as part of their staple diet. And one of the ways of preserving the fish correctly, as you correctly mentioned, is using salt, is what they call salting. So you see that they pour a lot of salt, someone takes anachota kwa mkono, then they pour it on the fish, and you see that these people will, for example, be walking with very high blood pressures of 180s, 160s, 170s. Actually, I've been to medical camps whereby people are walking around with very high blood pressures. So salt is one of the key things we have to advise our patients to actually reduce. I did not say completely stop, because salt also, in terms of, it has iodine, like at least currently in Kenya, there's sodium, which are also important. But for example, if you cook food with salt, then try as much as possible to reduce the excessive salt you go and pour. I remember one incident where I had a patient of mine whereby he would tell me that he has his plate of food, so before he pours the food on it, he would put some salt, like you're layering a cake or something like that, then you put the food, and then put another layer of salt, and you understand that is it's a lot of salt. So just monitor the salt that you take, reduce the salt amount that you take. Do not completely stop, because it's also helpful, but that's something else that I have to really emphasize on.
Okay, and since you've mentioned salt, there's a table salt, which is a bit finer. Is it much better than the other salt for cooking?
So again, this question has come up again a lot in terms of sea salt, which is very coarse, and there's the refined salt in terms of salt that is what we buy from the shops, etc. I would not comment per se and say that there's any specific difference in terms of table salt versus sea salt, or recommend any, because at least as far as I'm concerned, I stand to be corrected. There are people who are much more experts than me in this field. Salt is salt. Then, the thing is, just be cautious about the amounts of salt you're taking. If you go around in the supermarkets, I think you will see this, what they call salt for hypertensives, etc. I've not come across any studies that have been done specifically to say that one variety of salt is per se better than that. But again, I stand to be corrected. If anyone else has any information pertaining to that, please feel free to share.
Okay, and now we've talked about hypertension. Maybe we could talk a little bit about hypotension. Okay. Yeah.
Yes, so hypotension is the, let's say, lesser well-known cousin of hypertension. Again, people who develop hypertension are at risk, especially for my Muslim patients. A person will come and tell me, Daktari, I am praying in Salah, So I am in, sujood, or I am from at-tahiyat, and I want to stand up. And suddenly, when I'm standing up, I feel dizzy, or I feel like suddenly I'm not myself. Okay, so that's, for example, what we call postural hypertension. Or someone is seated in a seated position, and they suddenly stand up and they feel like the room is going round. So those are what we call hypertension. So it can present in that way. Okay. Now again, what you do is you have certain, based on the guidelines that we have certain values below which your blood pressure should not go. Again, we are created in such a way that we always have to maintain a range between one value and the other. So someone would become dizzy, they feel the room is going round, sometimes they can even, vomit or develop headaches, etc. Different people present differently. But the commonest one, as I said, is someone is from, a seated position, they stand up, not able to pump up as well. So then it's something we have to also at least get the blood pressure readings, see how well they are, and then we're able to manage it as appropriate. And also seen sometimes, for example, in ladies who bleed a lot, for example, during their menses. What happens is, because you're losing a lot of volume or blood volume within your system, then what happens is your blood pressure might slightly go down. So if you feel like you're very weak, etc., then it's good for you at least to get your blood pressure checked, and then we're able to give a way forward.
Okay, and there's something we've forgotten to touch on: hypertension. Let's say someone is pregnant and they have hypertension or hypotension. What can that person do? Let's say.
Yes, again, high blood pressure is in fact one of, if you look at the hierarchy of the five top leaders or commonest causes of maternal deaths or maternal mortalities, one of them is actually high blood pressure in pregnancy. And it's actually something which has to be very carefully followed up through pregnancy, and at least all the way until the baby is delivered, and even after delivery of the baby, it's important for us to monitor the blood pressure of the mom. As I've said, in terms of the different stages, there is one whereby it's just high blood pressure in pregnancy, and then sometimes it can progress and all the way up to even causing seizures, or like someone is developing like what we call kifafa. And that's an emergency. In fact, that patient is someone who should be monitored in an ICU kind of setting. So for all ladies or mothers who are pregnant or expecting, if you've had a previous history of high blood pressure in pregnancy, on your subsequent pregnancies or the ones that follow, it's important for you to tell your doctor that you've had a history of high blood pressure. That's number one. Number two, if you're a first-time mother, I would really emphasize it's good for you at least to go to your doctor and be followed up, what we call antenatal care clinics, ANC clinics. At least I'm happy that in Kenya, we have what we call the Beyond Zero initiative. In all public hospitals, antenatal care and delivery, maternal care is free of charge. So you have really no excuse for you to say that I was not able to follow up with a doctor in terms of that, because as you things that you check during the pregnancy are things like high blood pressure in pregnancy, sugar levels in pregnancy, for example, diabetes in pregnancy, the status of the fetus, how well the baby is doing, etc. So all those are at least helpful for us to monitor the progress of the pregnancy for both the mother and the baby who is growing. So it's something we really have to emphasize, at least for you to get your blood pressure checked during pregnancy. If the levels are okay and they are good, then alhamdulillah, there's really no problem. However, if the levels are deranged, then what happens is that we are able to take care of it in whatever clinical setting, whether in the hospital, and we'd advise as necessary.
Maybe you could give us your last words about the hypertension.
Yeah. So before I go to the last words, the other thing is in terms of treatment of hypertension. We have what we call treatment using medication, whereby a doctor will come, evaluate, and prescribe a certain number of medications. It could be 1, it could be 2, depending on how, like the stage of hypertension that you're in, are there any other complications, etc. So that's number 1. Then number 2 is, aside from you taking your medication, the other things I have to mention in terms of non-pharmacological or non-medical interventions, I would say, quote unquote. These are things like, for example, diet. So watch, for example, the salt that you're taking, especially. I would emphasize again on salt. Second thing I would say is increase, your stay well hydrated as much as you can. Number 3 is in terms of exercise. Again, exercise is helpful. What we call lifestyle modifications. If you're able, for example, just to just walk around or jog, if you're able to cycle, swim, something that whatever sport makes you happy, at least try to stay active. For those who really have problems with even getting to a gym or something like that, you can just walk. Walking is very, very helpful, and that at least reduces your weight, makes you maintain your shape, prevents you from having other chronic illnesses. If you remember last week in the discussion we had about diabetes, exercise was also coming up, and generally makes you feel raises your spirits and makes you feel better. So those are the things in terms of, I would say, lifestyle modifications, together with medication, where you stay compliant on your medication, monitor your blood pressures, follow up with your doctor wherever you are, and that is very, very helpful in terms of moving forward. For parting shot, I would say that, again, hypertension is not a death sentence. Many people get very worried. If you see that you have any symptoms pertaining with what we have discussed, then it's good for at least you to visit your doctor and be treated as appropriate. Again, as I've said also earlier, it's mostly silent. You would not have any symptoms. Patients would be very well, and then all of a sudden, you will hear that we were with this guy yesterday. What happened? And it's something that could have been, if we're able to monitor the pressures, then maybe we would have been able to intervene a bit earlier. So I would say it's something which we can be able to at least treat and monitor and follow up. So follow up wherever you are with your doctor, and we'll be able to help you as appropriate.
Okay, thank you so much for your time.
Thank you very much for having me.
As you've heard, too much salt is harmful to your health. For Health Matters, I have been your host, Naima Abdulwahab.